Financial security in the middle of a warming planet is an urgent priority now. In the Pro-Life UK Commission 2021 study, How Will Climate Change Affect the Health of Filipinos in the Next Decade? Making financial security as a climate adaptation measure is identified as one of the 5 major actions that we must do to protect our health amid the threats of climate change. The impacts of climate change on physical and mental health eventually affect the financial health of individuals, households, and communities. And while it is a challenge to measure the actual costs of climate-sensitive diseases on public and personal finances for now, it is widely known that healthcare needs lead to depletion of savings resulting from the hospitalization and loss of income due to absenteeism. Especially in the Philippines, where out-of-pocket expenses for medical needs is particularly high, the financial stress from ill health is more pronounced, especially among the lower-income families.
So among the disease conditions that will be affected by climate change, some of the main ones that really require greater financial protection are injuries and diseases and deaths related to extreme weather events such as typhoons and intense flooding. And the other one is infectious diseases like dengue and other mosquito-borne diseases. Why are these diseases should be the priority? These disease conditions impact many poor people in the Philippines. And these poor people, the poor populations, already have very limited financial capacity to address their needs. What more when disaster strikes, and therefore there will be a greater need for financial support to not only meet their needs, but also to be able to recover.
And we're starting to see that all around the world, where lower income people have less ability to protect themselves against the heat. They have nowhere to go. They're stuck in the heat. And this can create huge problems in terms of dehydration, in terms of heat stroke. Additionally, what else happens? As it gets hotter and hotter, there's new and different pathogens that show up. And these pathogens become much more aggressive when there's both heat and deficiencies in the way we're able to respond, vulnerabilities in our health. Both of these happen. And so there's a strong health aspect. And when we have this strong health aspect, what we also end up with is death. And we need to be thinking about the whole process here as insurers and thinking about how do we help to mitigate this. Think about people in the flood zones. Where do low-income people generally live? They live in the places that are cheapest. And the places that are cheapest are there, and they're cheap, and they're available because if anyone has any money, they want to go somewhere else. And that's why when people die in typhoons, when people die in floods, it's typically the low-income people that are stuck in those areas. So if we're going to be thinking about life, we also need to be thinking about what is it that's causing death? What's enhancing the potential for death? And we need to think about how can we approach that better? We need to think about this in a holistic manner. We have to start thinking more holistically about how do we help protect people from unnatural death, from the kinds of problems that are brought on by typhoons and heat and all these other significant issues. And we can't do this alone. We have to work together in bringing all these pieces and the skill sets of everyone. We need regulators or policymakers to set policies that we're going to address what I would call humane adaptation, or what we may call client-centered adaptation, but helping people to adapt in a way that they're not so risky, they're not so vulnerable. What we need there then is leadership in government. There has to be somebody high enough in the government to say, this agency, you need to work together with the insurers and the reinsurers to bring together a holistic, a thoughtful approach to how do we keep people out of these disaster risks? How do we mitigate their risks? And that ultimately is extremely helpful to life insurers, because then you have lesser surprise deaths that are due to climate change impacts. We have to think about this very importantly, because if we can start doing that and create not just an insurance product, but a risk management solution, that's what we need to be doing. That's what we need to be thinking about. Insurance will help in adaptation. It'll help in mitigating the damage that's done, because you have opportunities as insurers to improve the risk management approaches of your clients. And this, of course, pays off to you in that those clients then don't die in these events. We can't just worry about one person. We have to be thinking about societal resilience. How do we create structures, create processes that actually help people reduce the risks? We're not going to stop climate change. We're not going to stop typhoons. How can we help people to be better prepared for them and then have a better life? And this is an important role of life insurers and other insurers and government and others. How do we help to build that societal resilience and then use the insurance that we have and the products that we have to help both incentivize that and expand that? Because if you can reduce the risk, you reduce the price, since the risk premium is substantially the majority of the insurance premiums. Okay, you need to communicate climate and health knowledge to citizens. I like that. You do have to communicate. You have to help people to understand what the problem is that's coming to them and how to address that. We need to think about financial security at all levels in terms of adaptation. How do we help protect people in the long term, the short, medium, and long term, to have the kind of financial resilience and have that protected financial resilience even in the midst of climate change? Life insurers can help with adaptation and humane adaptation, helping people to make the right decisions by adjusting components of the life insurance. That's really important. Let's think about the link between climate risks, climate health risks, and financial security and poor health on the finances of Filipino families. If we think about how lower income people are at more risk and have more vulnerability, this has a chain that connects itself to further and further vulnerability. As they get more vulnerable, they're less and less able to manage the issues as they come. As people have less and less money, they're able to buy or rent less and less quality homes, less and less quality places to live, in places that are often dangerous, and certainly are much more vulnerable to climate change risks. So as they have less and less money, they end up with less and less ability to improve their vulnerability, their vulnerable situation. So you think about housing, they're living in more dangerous housing, more likely that dangerous things will happen, flooding, fires, and typhoon results. Heavy rains will accumulate at their homes because they're often living in the lower places. All this happens because of financial poverty. It sets you up to be more and more in a vulnerable situation, and that feeds on itself and puts you in a worse position. And all of this leads to healthcare issues and leads to mortality issues. Okay, if you can't get the right nutrition, you don't grow properly. If you can't get proper health care, then you're in a much higher risk level for death. And so these things, these pieces, if you're living in vulnerable housing situations, right, these pieces all come together to make it much more vulnerable in terms of even life itself. This has an important impact, yes, to health insurers, but it also has an important impact to life insurers. And you need to be thinking about how can we help to keep people from being at greater risk simply because of their economic situation. There are things that life insurers can do to help improve the lot of the low-income people. Life insurers are as a group, are amongst the largest investors in the world. Can you make profitable investments that help to improve the infrastructure that people are living in? And then can you tie that to insurance that protects their families when they die? What happens when the breadwinner dies? When the breadwinner dies, the whole family has a downward trajectory in terms of vulnerability. They get more and more vulnerable. How can you help with your investments? How can you help with these folks? Think about even working with the non-life insurers.
Prudential is a Pan-Asian Africa life and health insurer, which operates in 13 markets in Asia and 8 markets in Africa. We currently have more than 19 million customers, and 5 million of which they do have comprehensive health insurance with us. We understand healthcare is of huge demand in the markets we operate, mainly due to aging population, medical inflation, because of technological advancement, poor diet, and unhealthy lifestyle. All these put heavy pressure on the public healthcare system. Very often, residents in this part of the world may have to wait for a long time to see a doctor or to get admission into a hospital in the event of sickness. And on many occasions, they may not have the right access to healthcare and may not even afford to have annual screening or checkup. Their health status may therefore deteriorate and may lead to more complications, which can be very expensive to be cured and eventually may cost their lives. Very often, they like to stay healthy, but they don't know how. The demand in healthcare is compounded by climate change, the frequency, severity, duration, and location of weather and climate phenomena, like rising temperatures, heavy rains, and droughts, and some of other kinds of severe weather are all changing. This means that areas already experiencing health-threatening weather and climate phenomena such as severe heat or hurricanes are likely to experience worsening impacts, such as high temperatures and increased storm intensity, rainfalls, and storm surge. It also means some locations will experience new climate-related health threats. Climate change can therefore affect human health in 2 main ways. Firstly, by changing the severity or frequency of health problems that are already affected by climate or weather. And then the second is to create unprecedented or unanticipated health problems or health threats in places where they have not previously occurred. Therefore, our objective is to help our customers to have access to quality and affordable health care. We turn ourselves from a health payer to a health manager by launching Pulse in the region. This is our health ecosystem, which launched 3 years ago. We work with a number of healthcare partners to provide services such as symptom checker, health assessment, telemedicine consultations, nutrition and mental wellness applications, so as to help our customers to stay healthy. It also provides a lot of useful information to the users via Pulse, and it is available to all the residents in the region on a 24/7 basis, as long as they do have access to mobile phone and Wi-Fi. Most of the features offered by Pulse are free of charge, and today we have more than 33 million users download Pulse already, and it's available in 11 markets in Asia and 10 languages. We've been working also very closely with our network doctors and hospitals in the region so as to provide cashless hospitalization services to our health insurance policy holders by settling directly with the medical providers. We also ensure the patient journey is seamless during admission and discharge by offering second medical opinion and concierge service. Our range of health and protection product is huge in the region. It ranges from full comprehensive health insurance to critical illness, cancer, infectious disease, dengue, personal accidents, and they are distributed through our agency force, bank partners, and also digitally via Pulse. They are designed in such a way to meet the demand of all customer segments, and some of them, they are bite-sized protection products so that the underserved can also be benefited from it.
Our mission for our environment, social, and governance implementation is to help Filipinos around the world, including our beloved overseas Filipino workers, get the most out of life. Providing health and wealth protection is at the heart of what we do. Our products are designed to ensure millions of Filipinos and families live healthier and wealthier and mitigate the financial shocks from unfavorable life events so they can make the most out of life.
How can a simple insurance policy help Filipinos adapt to climate change?